Well, first, I was very appreciative and actually very welcoming. I heard from Veronica about the conference. We had met previously last year in Bucharest at the EAMBA meeting. And I actually appreciated very much the ongoing efforts to actually forward the clinical care and the research. And from my perspective, it's essential that the physician providers and the researchers and the community all collaborate together.
We would like to ask you if you could resume a little bit the what you were saying at your presentation today.
Oh. Well, the focus really was around comprehensive care, which, as I suggested, is really, it's sort of multiple perspectives on it. There's a comprehensive medical care, and then there's comprehensive care for the individual and their family. And the first part, in some respects, is a little easier because everyone sort of agrees that we need to have collaboration between all of the specialists. That would be neurologists, respiratory providers like myself, people in the clinics, as well as the inpatient, orthopedists, nutrition, gastroenterology, physical therapy, all of the different specialties, depending on the type of neuromuscular disease. One might be more prominent. If you have heart issues, we definitely want the cardiologist involved. So I think that actually makes more sense, or it's easier, I guess. It's more intuitive. And so if we have that collaboration, it's essential. Now, the challenge with that is getting all of us to collaborate and to cooperate, and that there are system issues in terms of how to operationalize that. It's sometimes challenging to get all of us together to help at one time. And even more challenging also is to get us to communicate. And so I think that is one of the challenges. We spoke also about some of the financial challenges because it's complex care and that takes time, and that the way our systems are set up currently is that sometimes they don't actually, it doesn't facilitate that the reimbursement and the hospitals and otherwise and the insurance companies, it just doesn't lend to that comprehensive care. It's easier to provide short, fast, easy, which is not what neuromuscular diseases really are. And then, it's also difficult because, especially with the rare diseases in the neuromuscular space, there are things that we don't know, and that you need to make sure that you're going to a center that's interested in exploring and perhaps engaged in research and other aspects of care so that we can all learn. And so you need someone who's willing, but also open to new ideas. The other part of the care, as I was suggesting, is really the comprehensive care. That as an individual with neuromuscular disease, you have things that are related to your medical needs, but it's how it relates to the rest of your life. And that's actually probably more challenging in terms of coordinating and time and effort, both on your part and very much on the provider's part, to make sure that we're doing the right thing. Unfortunately, without that, the medical care probably suffers and your health-related quality of life would suffer. And so comprehensive care is challenging and multiple factors.
As you are not only a presenter, but as well participant, how would you, what would you say about today's conference?
I think it's great. I was thrilled that this is the 6th conference. I suspect that it builds every year with some new themes as we see treatments. But I think it's helpful to bring people together. As I said, I think we aren't going to make progress in this space without the people affected by the neuromuscular disease, their families, the clinical providers, the pharmaceutical companies, and ultimately working to advocate with the hospitals and the payers and the insurance and those types of things. So it's great. And that's one of the reasons why you asked initially why I accepted the invitation, is that I think without that, we won't make progress. I was actually, my visit in the Czech Republic also was able to go to Brno and see visit the hospitals. I think my colleagues that I met with there are very interested in participating as well and moving forward and collaborating. I think everyone is faced with challenges, but I think it has to come, unfortunately, I think it has to come from advocacy groups like AMD. So yes, as I introduce myself, I'm Robert Graham. I'm actually a pediatric intensive care physician. So I did my pediatric training, but I also have done fellowships in critical care or intensive care. But my particular interest is in individuals with chronic illness because of the overlap between chronic and acute and the vulnerabilities there. And also recognizing that, by addressing some of the chronic needs, we may be able to avoid acute issues. And as part of that, developed a comprehensive care program and home ventilator program where we do home visits and we participate in multidisciplinary clinics and try to do comprehensive coordinated care. And through those efforts, actually, that's how I became engaged in the neuromuscular space. Because about early on 40, and now closer to 60% of the individuals that I work with and their families have some sort of neuromuscular condition and a range of types. And so by working with them and seeing what their needs are, it sort of forced me also into the research space and to become engaged in the in the therapy trials for SMA and myotubular myopathy and some of the other muscular dystrophies.
And how did you enjoy Prague?
Oh, well, my entire visit to the Czech Republic has been great. It's been too short, I would say. I had one day, as I said, visiting to Brno and went to the medical school there, and then a lecture at the Children's Hospital, which, as I said, was fantastic. The facilities were great, and the providers were very engaged and very interested. And then had a wonderful tour of Prague, which is a beautiful city, and a lot of history, and quite enjoyed the whole visit, from the food, the people, everything. So I truly enjoyed it.
Do you have some wish for our association of member of this association?
Actually, it's interesting because Don and I were speaking last night at dinner. I think it's challenging. The AMD is invaluable, I think, in terms of the community and forwarding the care and efforts. We were talking about sort of shared experiences that we've had, because I work with a number of organizations in the United States focusing on SMA and other neuromuscular diseases. And the problem is that it's often very fragmented, and it sounds like you have the same experience here, is that there are different advocacy groups, but they're not working together. And so I think it would be much more effective, recognizing that each condition may have different needs specifically, but in terms of pulling people together to common efforts for advocacy and working with the pharmaceutical companies and helping individuals navigate the general systems. And so I think AMD is remarkable as it covers a lot of conditions. But I think if there's a way to sort of pull in the other groups together, it would probably be much more effective.